Multiple people across the nation were killed or injured in incidents involving fireworks during this year's 4th of July celebrations.
We are still waiting to learn the exact number, but according to the U.S. Consumer Product Safety Commission, last year, 9,700 people were treated in emergency rooms. Joining us now is emergency medicine physician at Children's National Hospital, Dr. Caleb Ward. Thanks for joining us today, Dr. Ward.
Thanks for having me.
So I'm just curious, you must have seen a lot in your time as an ER doctor. In your experience, when it comes to fireworks, what kinds of things have you seen that really stick with you?
So this is sadly the firework injury season in emergency departments across the country, and it's not just July 4th, the weeks leading up to it and afterwards. ERs like mine and all those across the country are seeing children and adults injured by fireworks. Those injuries can take a whole range of things from burns, amputations, and in more serious cases where fireworks cause clothing to catch fire or even a house fire, we see more substantial injuries.
Each year, we talk about the potential danger when it comes to handling those fireworks, but we see these cases over and over and over again. Do you think that people aren't considering how dangerous it could be?
Absolutely. It's tough, right? I have children of my own at home and there's a lot of pressure, but the American Academy of Pediatrics gives pretty clear advice to parents to leave it to the professionals. There's a range of reasons people might not follow that advice, and it's worth noting that teenagers 15 to 19 years old are the most likely group to come into emergency departments with injuries.
What would you say to people who just have done it for a long time? Because I think that's the experience. They maybe grew up using fireworks. They figure they're pretty experienced. They know what they're doing. These people probably aren't using them for the very first time for the most part, right?
Absolutely. The first thing is just to remember that there's no such thing as a totally safe firework. Even those sparklers that we think of as pretty safe and benign, 700 kids each year are presenting to emergency departments with injuries from them. So some advice that I would share with all of my patients: if you're determined to do it yourself, make sure it's legal in your area, keep a bucket of water handy. It should only be the adults handling the fireworks, and then also avoid drinking alcohol or using other substances that might impair your judgment at the same time as you're using fireworks.
Now, you mentioned that these injuries can happen before and in the days after the 4th of July, so we're hoping that no one else is hurt. But should a child be injured, what should a parent try to do immediately?
Yeah, so if a child sustains burns, you're going to want to get emergency medical help. So that's usually by means of calling 911 and going to your nearest emergency department. And then the team there is going to be ready to care for those burn injuries, and if needed, get the help of burn specialists and plastic surgeons. Hopefully, most cases don't need that, but in most cases, I'd be advising families to seek help from their pediatrician or getting to the emergency department.
Are there any other issues that you've seen? You know, typically we think of burns or those really traumatic injuries, but how about the noise level? I would think your eyes and your ears would be at risk as well.
Yeah, eyes, ears, and lungs, as your report earlier noted. So we can see if you're very close to fireworks, we can occasionally see injuries to the eardrums. And then for folks who've got more sensitive lungs, folks with asthma or older folks maybe with COPD, the smoke related to fireworks can cause an increase in respiratory symptoms. So those are another group of folks that would be well advised to stay inside during fireworks season.
It's also sad to consider that one night of celebration can really change the course of your life. In terms of these injuries, how can this change someone's life moving forward if they're not handled the right way?
Absolutely. So there's both the physical consequences of burns, but also the mental health and social implications. And that's not just for the kid who's injured, siblings, parents, the guilt that can go with that. So any of those cases that are admitted to a hospital, you'll be cared for by a team of experts that will include not just doctors and nurses, but also social workers and mental health professionals to help those children and their families process some of the complex feelings that go along with sustaining an injury that by many accounts could have been preventable.
All right, could have been preventable. So a lot to think about, not only around the 4th of July, but New Year's. There's a lot of times of year where this just tends to come up. Dr. Ward from Children's National Hospital, thanks so much for joining us today.
Thanks for your time.